Good afternoon, and thank you all for joining us for the July 11th, 2022 monthly work session of the Charlotte-Mecklenburg Planning Commission. My name is Kiba Samuel, and I serve as chair of the Planning Commission, and we will go through some virtual or hybrid meeting protocols. Today's meeting is being streamed online in accordance with the state's electronic meeting statute. Requirements of notice, access, and minutes are being met through electronic means of public and media. You may watch this meeting live on the Planning, Design, and Development Department's YouTube page. Participants are muted to minimize interruptions. Please do not unmute unless you are speaking. To make a motion, please state your name before making a first or second. All votes will be done by roll call. Please respond when your name is called. We will begin with introductions here in the room and then move to our commissioners joining us virtually. Starting from my right, please.
Bill Gussman, Vice Chair, Planning Commission.
Aaron Barbie, Planning Commission.
Douglas Welton, Planning Commission.
Andrew Blumenthal, Planning Commission.
Joining us virtually for our commissioners, Commissioner Gaston.
Melissa Gaston, Planning Commission.
Commissioner Ham.
John Ham, Planning Commission.
Russell.
Commissioner Russell, Planning Committee.
Harvey.
RJ Harvey, Planning Commission.
Commissioner Spencer.
James Spencer, Planning Commission.
And I believe that's it for our commissioners. We will move to our staff introductions, beginning with those in the room. From my right, from my left. There's nobody on my right.
Candace Rory, Planning Staff.
Allison Craig, Interim Planning Director. Alicia Osborne, Planning Staff.
Kevin May, Planning Staff.
And we also have Siobhan Davis in the room, just for the record. And I think that we can now jump into our agenda with the meeting minutes from our last work session. Does anybody have any questions, notations, corrections? If not, is there a motion to approve?
This is Commissioner Barbie. I make a motion to approve the minutes from the last work session.
It's Commissioner Welton. I'll second that.
Motion by Barbie, second by Commissioner Walton. And we will take a roll call vote. Blumenthal.
Aye.
Gaston.
Aye.
Ham.
Aye.
Harvey.
Aye.
Gussman.
Aye.
Russell.
And what?
Aye.
Spencer.
Aye.
Barbie.
Aye.
Welton.
Aye.
Chair votes aye. That passes unanimous. Thank you. Moving on to our new business. There are, as we move into our 2040 comprehensive plan implementation phases, there are a couple topics that the executive committee wants to keep eye on. Interested in making sure we keep these things in our perspective. And as we're moving through some of our executive committee meetings, this particular topic, especially now that it's making the news with different entities closing their businesses that serve housing and homeless people, just something that we want to keep on the radar. As part of that, as part of our executive committee topics, Commissioner Barbie brought to our attention that, and I'm going to turn this over to her just to kick it off officially, is on the Leading on Opportunity Board, and they are doing some work around this topic. Thought it would be beneficial to bring it to the commission's attention at this time. Commissioner Barbie.
Thank you so much, Chairwoman. So I've had the opportunity to serve on the Housing and Homelessness Initiative as Charlotte looks at how do we really look at the continuum of housing and homelessness. And What a great opportunity to bring together minds across all disciplines to talk through what does the future look like and how do we really address the eradication of homelessness in Charlotte-Mecklenburg. So I'm excited today to be able to see Don Jonas, a dear friend of mine, who will be speaking on behalf of the initiative and will tell us more about next steps. Don?
Thank you, Erin. I really appreciate the opportunity to speak with you all. I think there are some slides. Look at that. They're coming up. Awesome. Thank you very much. I'm Don Jonas. I'm AVP for Social Strategy and Impact with Atrium Health. I've been in this role about 1.5 years. And one of the first things that I worked on, I was asked to support our CEO, Gene Woods, who co-chaired this housing and homelessness strategy initiative with Kathy Besant, senior executive in technology with Bank of America last year. This is really the very first time in our region's history that we've been able to pull together a comprehensive plan to address homelessness, to make it rare, brief, and non-recurring. There are, as you'll see, I wanted to give you an overview of the work that we've done and how we got to where we are. This is truly comprehensive in that it's looking at all the way from prevention to supply of housing to coordinated policy initiatives, and it is pulling in the public, private, nonprofit, faith sectors from the very beginning and through all that is included. And from the very beginning, this work has had individuals with lived experience that have been essential to the work that we've done. So it is not something that was created in a parlor of minds kind of thinking about what might work. We really wanted to understand what did folks that are experiencing homelessness or at risk of experiencing homelessness, what do they think that we need so that we can be much more effective as a broad community in addressing this. So what I'd like to do is give you a sort of a very high level, quick overview of the work and how we got to where we are and some of the highlights on where this is headed, and then open it up for a conversation and any questions that you might have. So the next slide, please. Yeah, so as a couple of highlights for where we are, you may have seen the sort of breaking news for us, which was really exciting, that United Way has been named as the local nonprofit lead agency that'll be working in sync with Mecklenburg County to set up an enduring structure. United Way will be that lead agency that will not only help with fundraising to pull this off, but also looking at how it would be implemented and how we will track our progress on this over the coming 5 years. It's very exciting. We knew as we got through this process over the course of the last year that it really needed to be housed somewhere with a group that had the trust and the leadership across the region and within neighborhoods to really pull this together. And I don't think there's any better option for us than United Way to play this role. I wanted to share with you, there are some quick wins based upon the framework that was created that we're already seeing. So we haven't sat on our hands. We haven't kind of waited for United Way to get on board. And there's been these quick wins have occurred across the board. There are 9 different functional areas that I want to highlight for you. And within each of those, there are already wins, even before United Way has really fully gotten into this role. United Way, in that third bullet there, it's noted they'll also develop a long-term implementation plan. So this is not something that we're going to do for the next month or the next 6 months or the next year. The intention is that all the different groups, and this represents more than 250 individuals that came together over the course of, it's almost 10 months worth of work. These hundreds of individuals from our community representing public, private, nonprofit, lived experience individuals. They said, we want to do this over the long haul. This is not something we're going to try to just sort of do and check a list and say we're done. We want to be committed to it for the long term. So I'll give you a little bit of background on the next slide. This work began with a vision of where we wanted to go. You'll see on the left side there where homelessness could become rare, brief, and non-recurring, and every person should have access to permanent, affordable housing and the resources to sustain it. And we have seen housing and affordable housing and homelessness has been, it's something that all communities across the country have been dealing with, and in fact has gotten more challenging in many ways during COVID-19. And yet there are glimmers of hope. There are places where we are seeing progress. Some of you may have seen a lead story in New York Times about Houston and the work that Houston has done to make homelessness rare, brief, and non-recurring. They actually, over the last 10 years, have reduced housing across their entire community by 63%. Thousands of individuals have found homes, and they did it through a similar kind of approach to what we pulled together with this group of leaders and community members over the last year. And there were really 4 different sort of core values where all of this work and all the recommendations that came from the report were housed. So it was addressing historical and structural inequities, so that we recognize that there are certain communities where there are barriers, and we needed to center and incorporate all of the work that we did with a racial justice and equity mindset. Secondly, we needed to expand access and availability of inventory and resources, and we wanted to encourage creativity, to think broadly and in new and different ways about how do you increase that inventory of affordable housing. Thirdly, to coordinate systems to ensure they're easy to navigate. That navigation was a term and was an idea that came up repeatedly during these conversations over the previous year, that we need to make it easier, not only for, most importantly, for individuals that are either at risk of experiencing homelessness or experiencing it now, but also for providers and for citizens and for anyone that wanted to get involved in this. How do we make it easy for people to navigate in the system, to get people to the right service at the right time for what they need? And the last thing driving all this was that, again, this wasn't something that we were going to do just overnight. It wasn't going to be for the next year. We really wanted to try to create a structure for long-term impact. We wanted to look at system changes. Unlike a lot of the awesome work that's been done in the past, we didn't want to just look at veterans that were experiencing homelessness, or the youth population, or just looking at prevention. We really wanted to look at it comprehensively, and that required an awful lot of work and some extraordinary leadership from a number of different organizations, the city and the county, Charlotte Center City Partners, my group at Atrium Health, but also Bank of America was involved throughout this, and in fact continues to be involved as we begin to transition this work to the United Way. The next slide, please. There you see, I think you may be familiar with this. We have not solved homelessness in our community. There are thousands of individuals who are experiencing, and this was a recent survey from the end of May. We had 3,300 of our neighbors experiencing homelessness, families and single individuals and unaccompanied youth. And it's a really difficult time with COVID, with the state of our economy. It's very difficult. You see that top right rectangular box, only 1% of total housing units built in Charlotte-Mecklenburg are affordable to households at 60% of the area median income. And we're looking at thousands of households that are uniquely at risk due to be evicted from their homes due to COVID-19. So there are so many individuals within our community that are severely cost burdened, that they're spending more than 30% of their income on housing. So there's an awful lot of folks, when we start to look out to where some of our challenges are in the very near term, if we don't get this right, if we're not taking this broader systemic approach to trying to address this and to make homelessness rare, brief, and non-recurring, we have almost a tsunami of challenges that are awaiting us down the road. So I'm grateful that our community came together to get us to where we are today. The next slide. I just wanted you to know that we didn't start from scratch. We're standing on the shoulders of giants. There's been some amazing work that's been done over the last really 20 years that have gotten us to where we are today. I would highlight the 2015, the Housing First Charlotte-Mecklenburg initiative began to end chronic homelessness. This sort of the literature and the research had taught us that what we needed to do, most importantly, if somebody is unhoused, the first thing they need is shelter. They need to very quickly be put into housing and then wrap around services to individuals, and not wait to get the services to ultimately get them into housing. And that was really a sort of a, in some ways, revolutionary approach that's happened in communities across the country and certainly here in Charlotte as well. But there are a number of different reports and analyses and approaches and interventions that have been tried and that have shown a lot of success over the years. I think even most recently in 2020, the Evaluate Upstream work of really putting together a coordinated approach to try to prevent individuals from falling into experiencing homelessness. Well, that all led us to this strategy and how we want to move forward and how we think we have the best opportunity right now to make a real difference in this space. If you go to the next slide. We really wanted to look at this on a full continuum. Again, we didn't want to look at just one piece of the homelessness challenge, but to think about it across the circle. And the circle could be me or you. It could be any one of us that may be in stable housing. We may have either a rental or a home ownership situation. But at any point, for all sorts of different reasons in life, you could move, if you were at the bottom, kind of moving up clockwise to housing instability, where you could find that you're at risk of losing your housing, of losing your not being able to pay your rent, of being evicted. And all of us, any one of us could fall into that top right category of being homelessness. And there's lots of different folks that are experiencing different types of homelessness. They could be doubled up. They may be unsheltered. They might be in a hotel. And there's all sorts of different supportive programs that are available within each of those areas. But it was important for us, we thought, not just to look at a sort of a solo shot of one issue related to this topic. In fact, within my team at Atrium Health, we found this model and this sort of approach to thinking about homelessness so effective. We've actually taken this as a way to put a strategy in place across Atrium Health of how we are involved in stable housing and housing instability and homelessness. And so we actually internally have a program that mirrors this work. And we think about how do we address each one of these three areas on that continuum as it deals with our patients that we serve, as it deals with our teammates, as we look at the community needs that are out there, as we think about policy advocacy in ways that our system should get more involved in standing shoulder to shoulder with groups like Roof Above or Crisis Assistance Ministry, or with the county or with others that are advocating for more enlightened policy and new and different ways to do this work, to not go off on our own and push for changes that we think might be helpful, but to really support those within this space that know these needs even better than we do. So I think this was really helpful for the group that was involved in this to help us wrap our arms around the variety of different ways that people experience these really critical human and family issues of affordable housing and homelessness. The next slide. So ultimately, we came up with recommendations. So again, there were over 200 individuals that dedicated really a year of time to help us put this together. There were 9 different work streams. There were 10 to 15 different recommendations within each of those work streams. There were multiple individuals that were serving in a technical leadership capacity to assist with this work. This strategy plan really was to be visionary, to be aspirational, to try to bring together the collective work of our community. And as noted, one of our core values, to center racial justice and equity within every one of the work streams, to be really the voice and the recommendation of our community, not the voice of Atrium Health or really of the city or the county or Bank of America or any other individual entity or organization, really the collective voice of our community, including those with lived experience, for how do we get to a long-term rather than a short-term lens to figure out how do we do this much more effectively to make homelessness rare, brief, and non-recurring. So the next slide, please. And there you see the value framework, the priority areas. So along the left-hand side are those 4 value areas that I talked about that really centered how we did this work. And you'll see these are just examples of, again, the 10 to 15 different priority areas that came out of these variety of different work streams that were doing their work on reducing the stigma associated with affordable housing, to implementing programs for very low-income households to simplify and streamline access to basic services, to make it easy for individuals to navigate the system, to strengthen the coordinated entry program. You see in the third one there, those life navigators, again, repeatedly hearing about just how critical it was for individuals to have guidance and support and navigation to help them weave their way through what can be an extraordinarily immediately challenging issue if you're at risk of losing housing or have become homeless. But then to figure out, how do I find from the panoply of different services that may or may not be out there, where is the best place to go for help? And then you'll see on those, in terms of thinking long term about how we take a system level approach to this, how do we better harness and utilize data when we make decisions? How do we coordinate the goals and the strategy and the funding across the public, private, and nonprofit sector in order to make a difference? Next slide, please. So that brought us to really the exciting news earlier this year. The strategic framework was released. It's available for anyone. Encourage you all to share this widely. If you haven't already looked at it, if you go to homeforallmec.com, you'll see the strategy. You'll get a background on all the individuals and all the organizations that were involved in pulling this together. You can get additional background on the values and how we decided to have this sort of aspirational vision, and what it was going to take to do the really, really difficult work is to take this ambitious strategy that was, again, formed widely by the community to actually move to the implementation of it. How do we raise the funding? How do we raise the will of our community to really advance what we think is achievable? Hard, nothing hard comes easy. This is not simple work. But how do we create the sort of framework that we think that's going to need to be there in order for this to be successfully implemented? So a couple of words on that, and then I'd love to take any questions or provide any additional background. So the next slide. So this is the enduring structure. Mecklenburg County will provide oversight and strategic alignment for this. Again, we're delighted and really fortunate. United Way of Central Carolinas will play a lead role to help to raise funding, to oversee the process and the outcome evaluation and the project management on a day-to-day basis. On the left-hand side, you see the advisory council, and this will include many of the reps that were part of the creation of the vision and of the strategy, individuals from the corporate sector, from the faith community, weighing in on this, making sure that they're included and that they find those places along the way where the private sector can support this work. And then also the role of a technical committee. They were really essential to kind of fact check and guide us as we went through this. These are subject matter experts that live in this space and understand what is within the realm of possibility for what we're doing, and also to course correct us as we were beginning to create this plan. They're going to stay with us as it moves into actual implementation of making a difference with this work. The next slide. Here's another way just to visualize it. This is, again, very high level, but you see the structure that I talked about on the previous slide at the top. And you think of all the different ways that organizations and individuals, whether they're in the private sector, they're part of a faith community or non-faith community. There's the continuum of care group that is here helping to prioritize HUD funding and many other issues related to homelessness. There are the City of Charlotte, Mecklenburg County, Homelessness Services Network. We see really a role for anyone and everyone that is working in this space. If we can find alignment around the strategy, there are just multiple ways that we think we can get individuals excited about this work and involved in what we're trying to move forward. The next slide, please. And so here I wanted to give you a very, very high level. Here are these 9 different areas. We have quick wins that have already been achieved from things that have happened with coordinated entry and strengthening prevention, sort of like Hollywood Squares. Pick one. You could look at the Grow Affordable Housing, some of the work that Olivian is doing on landlord engagement, middle box on policy advocacy, really exciting work and I think important work that the City of Charlotte has led on the source of income discrimination, some of the suggestions that are coming forward from the city. I've been on vacation the last week or so. I think that may have been presented to the City Council within the last week or so. New ways to communicate this work. And that's also linked up the communications box in the middle at the bottom, and then the coordinated funding alignment on the far right in the middle. There's a lot of linkages there. You see the CELC, the leading employers within the region that work through Foundation of the Carolinas. I'm serving on a work group that's looking at healthy communities and specifically looking at ways that the corporate community can be engaged in supporting this homelessness plan. So there's a homelessness work group that actually will be presenting this to the lead of the CLC leading members, so that we can figure out, this isn't something that we just hand off to the public sector or we hand off to a nonprofit agency. We know that for this to work, the private sector has to be engaged and invested in this work. So you'll see there's lots of different things that are happening. This is just a sort of a high level touch point. You can see the variety of ways that we're already making some progress on this plan. The next slide, please. So feedback and questions. I'd love to hear any thoughts or guidance. I've worked really closely, fortunately, with Maura Quinn. I see Maura is here with the Charlotte Center City Partners. I'm sure she may be able to add some context or answer questions if you have any as well. So welcome to open up the floor to any conversation.
Thank you so much for that presentation, Mr. Jonas. Before we open the floor up to questions, I just wanted to take a minute to apologize first and circle back to introductions. After we did staff introductions in the room, I failed to circle back to our virtual staff members, and I just wanted to give them the opportunity to introduce themselves.
Kathy Cornett, planning staff.
Robin Byers, planning staff.
Thank you both. Okay, and do we have any questions from our commissioners? Be monitoring the chat. Any questions here in the room? Commissioner Gussman?
Yes. As we, as a city, continue to try and increase housing opportunity, honestly, that meets this direct need, hopefully. Is there a number from your perspective that you've seen in your work that could be an endpoint? And I know the endpoint is always going to move. Is there an intermediary target, perhaps, of what we should be trying to develop? While we continue to try and develop it across the board, do we need to be looking for more specific development and a particular part of the spectrum, the particular part of the AMI, for example?
That's an excellent question. I'll ask Maura to weigh in as well. I would say, I think one of the things that we wanted to do was to get the United Way fully on board with this, so that their team could be hired and to help us to prioritize that answers to those very questions. And we do think that's unquestionably that 60% and below AMI is a particular pain point and is particularly challenging. We also think there's some really innovative ideas that are out there, but we didn't want to get the strategy part too far out into actual tangible targeted implementation until we had United Way on board, so that they could give us guidance and answers to questions like that. But I'll let Maura respond to that as well.
So thank you, Don, and thank you for making that presentation. So two things. Part of that is going to be answered as we put together an implementation plan. So what we did first, we have a strategic framework, and it's very high level. And we did a lot of research, and it informed our strategy recommendations, but we didn't get too deep into tactics. So the tactics will be answered inside of the implementation plan, as Don indicated. We also would defer, I think we would defer to the city for affordable housing. That's what the city does. And so we would defer there. But we also realize that 30% and below is really probably where we're talking about folks who are currently literally homeless. So that's 30% and below. And we know that that's really hard to do with market deals. And we know that that's probably where our public sector would need to step in, where our city and county city in particular would probably need to step in. And so we, but that's going to be part of the implementation plan. And then we, again, would defer to folks from the city and let them inform that work.
Excellent. Thank you. And I thought it was a reach to ask for a number, but I was curious if you guys might have had something floating around in your mind. Thank you, though. And great work.
Thank you, Commissioner Gusman. Any other hands in the room? Noticing none in the chat. I'll take an opportunity to ask a question fairly quickly. Mr. Jonas, you mentioned that there were 9, I think you said, different work streams that the group kind of pushed forward these recommendations. I'm wondering if, seeing as though technology was one of the touch points here, was there any exploration around 3D building, seeing as though the cost of building materials is sometimes a prohibitor for being able to achieve some affordability just throughout the country, not just here in Charlotte, but with the availability and the cost of building materials. Just wondering if any type of 3D building or any other type technologies were explored as part of the work streams or might be part of the recommendations.
Yeah, that did come up within that work stream. I was not a part of that. I had seen the reports that came out of it, but you're absolutely right. There are so many different technological innovations that have occurred in this space. I've recently learned about a product that's being provided at very low to no cost that Amazon has developed, a digital locker, which the city of Baltimore is utilizing, and it's something that's provided to folks that are experiencing homelessness so they can keep all of their most essential documents, whether it's a social security card or it might be a COVID vaccination card. It can all be accessible by that individual or to anyone that they might designate. And it was receiving some, in the literature that I had read, some very positive reviews from the city of Baltimore. So just to say, I think you're absolutely right to be thinking about alternative building designs of these sorts of digital technologies that can streamline the process to make it more effective what we're trying to achieve. And it just reminds me of the sort of spirit of innovation that we saw within all 9 of those work groups. And then not always just technological innovations. I think there's some amazing work that's happening in the NOAA space, the naturally occurring affordable housing that we've been, as a system, have been invested in and would like to do more of that kind of work. So great question. And I know that it was a discussion on the building opportunities that came up. And I think that would be included as one of those. I think it's anywhere from 10 to 15 different recommendations that were within that group that was looking at that. Wouldn't surprise me if that's something that gets prioritized as United Way dives in further to this work.
Thank you for that. It's encouraging to hear. I'm familiar with one particular 3D home builders called Icon. They're based out of Austin, Texas, I believe. They were formed basically as a result of trying to resolve the homelessness issue. So just interesting to see how that company's, I think they've been off the ground for about 5 years now, and did their first intro for the city of Austin back in March. And they're doing big things there.
That's
Good to
awesome.
hear. I see Commissioner Russell has a hand up.
Yes, thank you, Madam Chair. Mr. Jonas, thank you for coming and speaking to us. I wanted to follow up a little bit more on the thread that Commissioner Samuel was talking about as far as reducing costs. And my thought is on micro housing. Has that been considered? I do have a couple of ideas that I will share with you later on, but have you considered the possibility of doing micro housing as a transition from folks who are chronically homeless into something, more stable, like a single family home or something like that, an apartment?
Yes, that was one of the things that came up. I don't have it at my fingertips, but I know it is considered as part of one of the potential priority areas. And I don't know if Maura, you may have that closer. I do recall there were multiple discussions about that, of looking at the broad range of how quickly do you get someone into a sheltered situation, which might include those sort of smaller units. But Maura?
Yes, those were some of the recommendations inside the strategic framework for auxiliary units and for micro units and for possibly even campgrounds. So there were a number of things to consider that would be alternatives to either shelter, street, permanent shelter. So there actually is a universe in between. So we did consider those and list them as possibilities to be considered.
Yeah, because you're talking about material and building costs and those things that are very high right now. The market is very unsettled. And so there's a thought that the smaller the structure, the less per square foot cost it would be, and it would be more cost effective to do so. So thank you for answering that question.
Thanks. Cool.
Thank you, Commissioner Russell. Mr. Jonas, if you don't mind, I don't see any more questions or hands raised in the chat. If available, would it be possible to share the published version of the work in the chat? Post a link to it?
Yes, Maura, is that something you can add?
Awesome.
Yes,
Thank you so
we'll do
much.
it.
Thank you. Thank you both.
Appreciate the opportunity, really. Thank you for what you all do. And if you need any follow-up or you have any additional questions, I hope you'll reach out to me or to Maura and be happy to provide you anything you need.
Thank you for the offer. If you could also put contact information in the chat, that would be helpful.
Will do.
Awesome. Thank you. Okay, we'll move to our next new business item. And Allison, you want to tee up the comp plan update?
Sure, thank you. So Alicia and Kathy and Robin are here just to talk about, we're a year out now. The comp plan was passed, of course, in June 21st, 2021. So we are now a year into that. And so the team has been working on putting together a report of just what we've accomplished, what do we see going ahead, and just some other implementation items that that we're happy to share with you today. So with that, I'll turn it over to Alicia.
And I don't have a presentation. It'll be really, really quick. So Allison mentioned that again, the plan was adopted last year, and thank you to this group, particularly for your support in those initiatives. And there's three key items or bodies of work that we want to put on your radar for the next couple of months, particularly in September. That's the community area planning process. The comp plan shared a community planning approach, which is a very refined and streamlined approach to how we do community planning in the future. One being having clearly defined geographies that there are 15 geographies that we will focus in and make sure that every part of our community has coverage of a planning initiative. There's more of a neighborhood-based approach. So we'll bring back a schedule and kind of a preliminary list of those areas in terms of order that we'll do them back in September when we come back to this group. We'll also share prioritization criteria, how we are thinking about a data-driven approach to deciding where we go first, and also sharing the contents of that plan and how we plan to staff it. I know that's been a really big concern, how you're going to do that many plans in such a short amount of time. Because we're superhuman. That is how we're going to do it. The same way we did the comp plan, but better. So that's the the community area planning process. The next thing that we want to make sure to bring back to you in September, we're still refining and cleaning up our annual report, which is to serve as our annual benchmark that shares how well are we implementing the plan. And again, it's not just a planning report. It's all of our departments and how we're all contributing to implementing the vision within the comprehensive plan. So we'll have that for you as well, hopefully before September, but definitely a deeper dive into that. And also the dashboard, implementation dashboard, which is the really geeky part of the annual report. It looks at the measures and the metrics in the plan, and understanding that we have a lot of metrics that we will start to report on. And then there are metrics that we will begin to include over the years as we learn know more about the projects and programs to implement the vision. And then the other thing that I wanted to also make sure that's on your radar too, that will be included in the annual report, is we had 3 community advisory groups that have been meeting and having more granular discussions around anti-displacement. That's the NEST committee, which was commissioned by council. That group is also included in our reporting work around how are we moving forward with some initiatives around anti-displacement. The Equitable Development Commission, which just recently started meeting, but they have a really focused work program or charge that they're looking at. And I think it's the corridors of opportunity work. And so just really connecting the dots with the vision that's a part of their work and how we make decisions about dollars and making sure that we're being equitable in that distribution of funding. And then there was a non-commissioned group, but a task force to help us to better understand what is community benefits, not the agreement, the tool, but what do we mean by that? How do we define it? So a group of stakeholders have been meeting and really working together, a cross-section of neighborhood representatives, developers, industry professionals, really working together in a room to say, hey, this is what this means for Charlotte, because it means something different to every community. So we were able to come up with a definition that we all agreed on and some really robust tools that we can implement today, a lot of that work, and start to think about how to incorporate it into our work programs in the future. So Robin Byers on the phone has really been leading that work and working really closely with our departments and the stakeholders to make sure that we have an action plan. So that's a lookbook that they have created, and we'll bring that back to you in September as well. So we have a lot of things to come, but we knew that July was a really good time to touch base with you all to let you know what we're working on. Yes, we are working a lot. So those are the 3 big buckets of work that we want to make sure that you know that are on the horizon. With that, I'll take any questions if you have any.
I'm sure we have a couple.
The chat.
All right. I guess this is maybe a 30,000 foot view. The 3 work groups that will somehow have a contribution to possibly an annual update or implementation strategy for the comp plan. At what level does that happen? And is it the same for each of these 3 work groups?
I think it's safe to say that all 3, the recommendations that are coming out of them, a lot of them are at the staff work program level. So a lot of the actions that, particularly within that community benefits group, for example, providing more engagement around the development process, those we can implement at the staff level. Then there are some things that are recommended in terms of policy that will likely go before council or to this body for recommendation. So it's at various levels, but for the most part, in all 3 groups, those are things that we can easily incorporate into our work program. I know Allison's been working with Liz and Rebecca Hefner and I think Hannah to really look at what are these things. I think Tracy as well. What can we do from the staff level? Just roll them into our work program so there's not a lot of delay in making decisions about what moves forward. And a lot of them we can already do, if not already planning to do.
Got it. Allison, you were going to add to that?
No, I was just going to say, I mean, there, like as Alicia mentioned early in her comments, that the work of the comprehensive plan touches so many different city departments. And so therefore, all the things that we start talking about as it relates to implementation don't just live in the planning department. And so we start to see them in other committees and commissions, and we want to try and make sure we're looking at the body of work holistically, but recognizing that some groups are tackling specific issues. Like, I think Triple E is looking at, citywide engagement policy. There's lots of discussions with Nest about just the UDO and displacement and things like that. And so we're just working to make sure that we're connecting all those dots. And I've been having conversations with those in the manager's office just to make sure we're keeping that coordinated.
Clear. And then the lookbook.
Mhm.
And I may have missed it the first time you introduced it, but it's created by which or all three work groups?
That's just the community benefits. Yeah. And it's a partnership with city staff from the various departments and the stakeholder group that was involved. So they're in the review process for that now.
Gotcha.
It'll be ready in September.
And then final, just a note, not necessarily a question. I think I heard the word September in most of this. And so my executive committee is over here laughing because we know that's the month of our annual retreat. So I think we are maybe that agenda is starting to take shape based on your quick 5-minute update. So thank you so much for that. Any other questions or comments? Commissioner Barbie.
Thank you so much for that update. I heard September, but I also heard aggressive. Like, you all are on top of it for the amount of things you want to produce for us to be able to digest. Can you touch back again on the dashboard and what to expect? When I hear dashboard, I hear that it's comprehensive and that we would be able to easily navigate all of the moving parts. And it's difficult to prioritize because things are still moving. So can you revisit for me what's most important to show in that dashboard?
So I'll start and then flip it over to Robin to get more detail. But essentially, the dashboard will take the 10 plan goals and objectives and the metrics and the measures that are reported within the comp plan and provide simply where are we. And a part of that is to really look at across the city, how are we doing to support that particular goal? And the way it's designed to be fairly user-friendly, it will have an instructional video and then I think a highlight summary of what's in it, how to use it and that type of thing. So they're working on it and testing it now to make sure that we meet the charge of being user-friendly. So if I missed anything, Robin, please jump in and let us know.
I think that's the general intent. What I will say, you guys saw a version of this in November. We have had to update our software a bit to make it more user-friendly. So what you will see when we come back in September will be a little different. We have about 25% of the data available. And so each year for probably the next 5 years, we'll get more robust with the data we're collecting. And then once we have everything, we'll be able to streamline it even more to show you where our progress is for each goal.
Thank you for that. And more on maybe the visioning side, is there a big vision, maybe Allison, this is for you, that we bring all of these things into one location? So when I think dashboard, can I go to UDO and see where they are, and maybe the mobility plan and see where they are from like a one-stop shop? Is that our future?
There actually is a website now that has the strategic mobility plan, comp plan, and UDO on it. That actually does exist.
Yes.
So we need some work on our website. So we will keep that in mind as we start to talk with the web designers about what that looks like next. But we at least have those three all together.
Thank you. We love a good one-stop shop. Thank you.
Tiny wins, tiny wins. Commissioner Gusman.
Yeah, so I mostly just wanted, after 12 months of not being able to ask Alicia about a timeline, I mostly wanted to bring that up. But it sounds like most of it we've sussed out in our previous conversation. So we're thinking September, though, in broad terms, right? For dashboard and some of these reports.
Oh,
and
yeah,
everything.
we have it now. We're just refining it to make sure that everything works like we want it. So we have pretty close to the end.
Perfect.
So September for sure, if not
Excellent.
soon.
Thank you.
Seeing no more hands raised, I think we can move on to the UDO update. And Allison, I think, is going to kick us off.
So in case you hadn't heard, there's sort of a public hearing tonight on the UDO. So I'm sure we'll all be watching with eager anticipation. So we don't have really a lengthy update here today, just kind of want to talk to you about what the next steps are, after tonight. So I'll turn it over to Laura.
Thank you, Allison. I think we can go to with the one slide. And just real briefly to remind you guys that we released the second draft on June the 3rd. Took comments on that. I think we are right at 290 comments. Plus we had a number of virtual sessions where we heard feedback and closed the comment portal on the 30th of June. And obviously we're going to public hearing, a huge milestone for the project this evening. We will be at Planning Committee next week with recommended changes based on things that we heard through our engagement process, as well as potentially if we hear something new tonight that we should consider. We'll be listening for that as well. We will be providing a matrix of changes. So in addition to providing a document where the changes will be highlighted since the last draft, we'll also be providing a matrix of changes so that you can go down the matrix and find out what page certain changes on and what the purpose of that change is. So we'll be at Planning Committee next Tuesday, and then we'll be asking for council decision on August 22nd. So that's kind of it for today. Well, maybe not it for today, but it for noontime.
Shortest UDO update we've ever had. So we can tell we're nearing the finish line here. Do we have any questions for Laura? Commissioner Walton, I see.
Just a quick one, Laura. I didn't know if you had a count already of people that were going to speak at the public hearing tonight, or have you gotten any
I
indication?
think the last we saw was 25.
24 is what I have,
Okay.
but that was in the version that was sent to me this 10 o'clock or so.
How much time does everybody get?
Well, the mayor can make changes, which, she's done like with the comp plan. So we'll see. Right
Okay.
now they get 3 minutes is my understanding.
Yeah, I was thinking it was 3 minutes, so
Yeah.
it's like, okay. Thank you.
I have a feeling the number's going to go up though.
I was just about to say, don't hold your breath at 25. Oh, yeah, I don't think it will exceed that. It will, I think Allison was hinting that it could be shorter. For sure. So I think that I've tried to make sure that everybody was prepared for tonight's meeting. I know several of us will be in the chambers tonight, hearing firsthand, supporting planning staff. The OAC meeting that was last week, I think. I think there are some of those partners that are planning to speak in support of, and rightfully so. I look forward to seeing those of you who have RSVP'd. Allison, I'll get you that final number, Candace, so that you guys can have a count for Planning Commission. A couple things before we move to Ed and Streets Manual. Actually, no, I can do the wrap up after Ed's presentation. So are you going to kick off Streets Manual for Ed?
I can. So tonight there'll be the second public hearing, of course, is on the streets map and the streets manual, which is a really important complement to the UDO. There are requirements in the UDO that depend on your street classification. There are requirements in the comprehensive transportation review that depend on sort of the context in your zoning district. So these are really intended to work hand in hand. So I will turn it over to Ed.
And before Ed begins his presentation, as he's pulling up his slideshow, the slide deck, do you happen to know the information about the in-between council meetings? So after public draft, there was a council meeting on, I believe, the 5th of June and some subsequent ones. And I believe twice at TAP now. Can you just run through those visits if you have them handy?
Just what we talked about, or?
No, just the actual sessions.
I don't know if I have the dates off the top of my
Okay.
head. Sorry.
We're ready, Ed. Thanks.
Good. Well, thank you. Again, I'm Ed McKinney with CDOT, and I think what we want to do today is just give you an update on where we are with the streets manual. I think we were trying to remember now, we were back in front of the Planning Commission 3 or 4 months ago. So this, hopefully the intent here is just to give you a little bit of sense of what we've done since then. There's been, just like the UDO, we've gone through a public review, some comments, some updates and changes to the draft. And just like the UDO tonight, after the UDO public hearing and comments, we'll have a public comment period on the streets manual as well. And so, again, what I'd like to do today is just give you, again, a little bit of a reminder about what the manual is and talk a little bit about the changes and the updates and some analysis that we've done, just to give you a sense of the work that's been going on. I think we've shared this before with you, but it's just a good reminder. You're talking certainly about the implementation of the comprehensive plan and things like the UDO. So this is a good reminder about where all this work kind of fits in the broader context. The strategic mobility plan, I think we've talked with the Planning Commission about as well, got adopted by council last month. That is, as a reminder, kind of the mobility policy piece really related to the comprehensive plan. It's sort of the next level of detail. It pulled, one of the 10 goals, which was a mobility goal in the comprehensive plan. We used that as the foundation and just used the strategic mobility plan again to put some more detail to that policy and that strategy. The strategic mobility plan, the simplest way to think about it is it's really about public investment and how we move forward with mobility and sort of strategic thinking and investment around mobility. The manual, as you see here, is really around what we do and how we regulate private development and private investment related to transportation. And so, as we've talked about before, it's really technically very specifically connected to the Unified Development Ordinance. I'll talk a little bit about that as we go forward. There's again 3 components to that manual that are sort of the basic foundation of what this manual is. And so what it really is taking a lot of things that we already had from a policy standpoint, put them into one place. And again, all the things that are development related from a transportation standpoint sit within this manual. It's really all the key parts. Streets map, I'll talk about that and again in a moment. That's really the kind of framework and vision around our streets, and really a key part of that is protecting the right of way as development occurs, so that we can have the longer term investment in our streets and corridors as private investment occurs, and then as we prioritize public investment. There's a piece of this that is really just a reflection of what we already have, the access and management and driveway guidelines. These are just really technical based, sort of access things that we've already had. We always have had those, and this is just pulling them into this one location, this one manual. And then, one of the biggest new things is this comprehensive transportation review. And that's really a complete update of our transportation impact study guidelines. And I'll talk a little bit about those in more detail as well, and some analysis that we did around those guidelines to help us understand how they were actually going to be implemented. Just a reminder, I think we shared this graphic with you before, this notion of how important the streets map is to the Unified Development Ordinance and even the place type and comprehensive plan vision around the 2040 policy map. The message here is, again, we're trying to do in the streets map is make sure that we're protecting for all the multimodal facilities we need on every major corridor in our city, so that as development occurs, it's putting it in place that allows us to protect for that right of way. And it has, again, this very specific connection to the UDO. And so if you're a certain type of street in the streets manual, that's tied to and referenced in the Unified Development Ordinance. So if you're in this case, a transit urban center zoning category in the UDO, it'll tie you, if you're on a certain type of street, in this case, an avenue, the UDO will give you some very specific things around setback and even building articulation in some cases. And so, as I think I mentioned before, that's a really profound thing, right? The notion that we're really connecting the regulations and our expectations around private development to the public realm and to the streets. And so it's a good reminder to say that is a big deal. It's a really important thing. It's a pretty innovative thing. And it's the goal there is really to connect our vision around both development and transportation in a real direct way. The streets map is comprehensive. You can see on this map, it essentially takes all of our arterial network and gives it a certain classification. This notion of these certain types of streets all the way down from larger parkways to, in very specific locations, main streets, where we've got, again, some very detailed expectations around both the street design and certainly the development guidelines around as certain places develop. One thing I'll mention here, one thing we added, I think since the last time we talked, there was some additional work we needed to do around including the uptown streets. And so they're totally different. They don't use this classification. There was an adopted sort of transportation plan for uptown that had their own street classifications in it. So what we've been doing is taking those classifications, translating them in the right way, and then incorporating them into the streets map. So again, that's sort of a pretty significant new thing that we did in the last 6 months or so in terms of the updating and refining of the streets map. Just a summary, a little bit about the changes and some of the updates we've made based on sort of discussion and public comment. There's some work we did around the collectors, some additional analysis, particularly around the notion that as we were doing this work, the policy map work was sort of happening concurrently. And so now as that's been finalized and adopted, it was important for us to make sure that if there were any refinements we needed to do around some classifications, we needed to do that. And so collectors was one where we've, again, refined some of that thinking related to the adopted policy map. As I mentioned, we've included the uptown streets. We've also a little bit just very specific kind of testing of some key corridors, making sure that we got the facility types right, just some really very technical kind of refinements. And then the last thing on here, we also needed to be a little clearer about how the map gets amended. And so there's some additional detail around that and some flexibility, some appropriate kind of flexibility around how the CDOT director has some ability, particularly as development occurs, there needed to be a certain amount of context specific ability to kind of address, some unique conditions that might happen project by project. So that's the streets map, just kind of where we were and some updates in the draft. Next thing I want to talk a little bit about more is the comprehensive transportation review guidelines. Again, a lot of words there, but the reason why this notion of comprehensive is important because as we've talked about this before, we've expanded this to not just look at vehicular impacts and the impacts around how we move cars. Again, vision all the way from the comp plan to the strategic mobility plan to broad policies that council has. We have broader expectations around multimodal investment, multimodal improvement, and making sure in this case that we have private development doing its fair share to help us set up for the right kind of framework for streets and the right kind of public investment we would make in the long term. As we talked about, again, this notion that there's a couple of, the really way to simplify it is, for us, how are we moving people? That's the multimodal kind of component of that. That includes sidewalks, that includes pedestrian crossings in some places. It includes investment we need to make in accessibility throughout our whole city. So there's lots of needs that we have, and this component of the analysis to make sure that, again, appropriately for the scale of the development, we had a way to kind of make sure those investments were being made. Reducing trips, the notion of TDM, transportation demand management, is a new thing. And again, that's pretty specific to our most high intensity places, our regional activity centers like Uptown or the station areas around our transit stations, there's lots of opportunities we can do and have around just making sure projects do the kinds of things they can and should do to just get people out of their cars and to support, in many cases, transit is a good example. And then absolutely, we're still doing traffic analysis, and we've made some refinements to what the thresholds are and to kind of this notion of high and low intensity. So we've rethought those a little bit, but again, the message there is we still know that as development occurs, there are traffic impacts and there are improvements that we can be making in our street system to reflect those impacts. We did an analysis. So one of the things we've been doing over the last 6 months or so is to really test these guidelines, and several, lots of pretty, very important questions that we got, particularly around the development community is, okay, what does this mean? How many more, what kind of analysis this is going to require for projects? What's the order of magnitude? There certainly was some concern around just, is this going to bog down the development review process, all of those things. And so it was important for us to do an analysis of that, testing it again with the UDO, evaluating that impact to land development, the process, and then in this case, again, potentially identifying some changes and some updates based on that analysis. As a reminder, there's a lot on this slide, but what I want to emphasize here is some key parts of how the analysis and the CTR works. We created this kind of low intensity and high intensity kind of categorization. And the notion there is we understand, given the scale of Charlotte, over 300 square miles, the conditions are completely different. You got places like Uptown and you got places like Steel Creek. And so the notion that one size fits all just doesn't work for the scale of what Charlotte is. And so there are places where what we believe to be a different approach is appropriate if you're in a lower intensity place versus a high intensity place. We have tied those very specifically to the UDO again. So it's zoning district specific. And so there's absolute clarity about that. And it was really tied to, again, the level of intensity and anticipation that the UDO was wiring into their zoning districts. A couple of other things to say about this, the multimodal assessment on this chart, the notion also that depending upon the scale of your project, we have sort of different tiers. And so if you're a larger project with larger impacts, the tiers around multimodal investment will certainly reflect that. And so both in the low intensity and high intensity places, there's sort of a more refined kind of calibration around how we look at the impacts of projects. The desired outcome, again, multimodal investment, and then appropriate sort of scaled transportation investment, vehicular investment, but again, with a new and pretty specific focus on the multimodal investment. Just to give you the scale of the analysis. And so we looked at over 235 projects. I'll talk about the detail that we looked at those. We took sort of snapshots of different sort of data points. And so in this case, we took all the conditional rezoning petitions from 2020. We looked at a snapshot third quarter of 2020 of by right development projects. So we took all those permits and looked at them. And then there was a UDO economic analysis that was conducted by the planning department in Allison that looked at some very specific case studies. So we took all those case studies as well. And so again, the notion of all of that gave us kind of a pretty significant snapshot across different conditions for us to kind of look at, again, how would these guidelines apply? This gives you a sense of the detail that we looked at. This was actually one of the economic impact case studies. And so, I won't go through all the details, but on the right side of this slide, we took this case study, we looked at this was in this case a conditional rezoning approval, which had some very specific conditions in that rezoning. So we looked at all of those conditions. We said, okay, how would they fit and apply to our multimodal assessment, to our TDM assessment, to the traffic impact study, just to kind of understand how the points might work, and does it reflect, sort of a fair share, sort of scaled approach to development. The message on this one is a very, unique one, and it's important because I think it applies to a lot of the projects. In this case, through the conditional rezoning process, given the categorization that we had, it actually met most of our expectations, particularly around this tier of multimodal assessment. So for us, that's a good reflection that, one of our intents was to make sure that these guidelines could be applied to by right development and were reflecting essentially the expectations and the negotiations that we go through project by project with conditional rezonings. And so message one on here is that, for our standpoint, the analysis tells us that the guidelines that we've created, the tiers, the point system, is a good reflection of kind of what we're getting in conditional rezonings, right? Where we spend months and months of work. It goes through, the planning committee, it goes through a public process. A lot of work goes into that. What we've done, we believe, is the comprehensive transportation review guidelines essentially establish a predictable way to get the same outcome. Another point to make on this is this project did do a traffic study through the conditional rezoning process. Because of its urban context, it really didn't identify anything appropriate. Like there wasn't, we didn't want to put a right turn lane in this kind of urban context because it was really counter to the environment that we're trying to create. The point there is we spent a lot of time doing a technical analysis. It didn't identify projects. We ended up negotiating all these other things. And so for us, there's an efficiency about this. In some cases, it doesn't make sense to do a traffic impact study. But what we are doing with the CTR is making sure we're not missing the opportunities to still get all of the things that we would negotiate. And so for us, that's an efficiency thing. It's a more predictable thing. It's transparent, to the public and to the council and to this commission to get the same outcomes, but not spend and waste time on the things that don't make sense. That's not the case for every project. So I'm just using that as one example that in particular urban places, there's just not a need to do that kind of traffic work when the guidelines will help us get what we were going to get through that negotiation. Bottom line on this, go back to the 235 projects that we evaluated. Some of them, in this case, you can see 36 on that existing TIS. So some of the 88 projects that triggered a CTR out of the 235, a number of them, in this case 36, were already doing a traffic impact study. So sort of subtract that out of the analysis. At the bottom, it tells you, okay, there's 52 new CTRs that came from that 88 projects. 7 of those had new TISs, traffic impact studies. The message here is the 52 and the 7, the notion that what we're getting now is a significant focused impact on the multimodal piece, the CTR analysis. We're getting some increase in traffic impact studies, which is, again, we anticipated that, and particularly in by right conditions, it was important for us to make sure that we were still getting some additional traffic impact studies, particularly in some of the more growing places. But again, the message here is the focus is on multimodal investment, appropriate increase in traffic impact study analysis, but manageable from our perspective. The multimodal work doesn't require an analysis. It's really a site plan sort of exercise that is done by the development team that already exists. They're not having to hire additional consultants. They have a site engineer or site designer that would be able to do all the things and identify the investments in the multimodal analysis. So that, again, the message there is it's not requiring additional time or work from the development community. It's really being predictable about what we want to achieve from a multimodal analysis. Yes, there are some new traffic impact studies, and yes, those require, traffic engineers and specific studies that are conducted. But in this case, we believe that's not it's sort of a level of impact that is significant. There's, we heard from, I think we hear from this planning committee. We certainly hear from council about the desire, particularly given the pace of growth, that we do need to be doing that kind of traffic work. In this case, we think we've identified that appropriately, increased it, but not at a level that would have a significant impact on the development process and the kind of, the pace of development in their analysis. The other point I'll make using this slide is not to get into all the numbers and analysis, but we took all those projects Again, particularly around the multimodal investment, which ones were tier 1, tier 2, tier 3, were they high or low intensity? You add all that up, and part of the calibration of the points told us that essentially each point equates to about $10,000 worth of investment. So it was relatively easy for us to kind of do the math. What the math told us on those 88 projects was $7 million worth of private investment in all of the things that we want from a public standpoint in terms of the multimodal the multimodal environment we're trying to create. Giving you an example, like in a tier 1 at the top of the slide, 3 points, that means a project's investing $30,000. If you're 9 points at that scale, you're investing $90,000. Give you a say, certainly that means projects, private development projects are, there is a cost to that. But again, we believe, given the scale of the project, that cost is calibrated in a way that's equitable to the impact of the development project is happening. And then when you add that up cumulatively, it actually creates a pretty significant amount of investment. So the message there is we believe the expectation from a private standpoint is calibrated in a way that's fair. It's their fair share of their impact from a multimodal standpoint. And when you do the math and look at the cumulative impact, that's significant for us. It gives us a lot of investment throughout our city to make sure that we're building the kind of multimodal environment that all of our policies and all of our plans expect. We did, through that analysis, we did identify some things that we did need to kind of refine. The mitigation value, as I mentioned, we did some analysis. There's a menu. So if you have 3 points, for example, we have a menu of how you would achieve those points. You might do an additional segment of sidewalk. You might do a pedestrian crossing. Again, that analysis told us that depending upon the investment you're making, those points more or less equate to about $10,000 worth of investment. We needed to do a little bit refining of that menu to make sure that that was clear and consistent. So we did some of that. We also created a fee and lieu option. So there are places and situations where, for a variety of reasons, it doesn't make sense for the private development to do the investment. It might be a pedestrian crossing, a block away. There's, right away or easements that's required, and it's a project that's probably easier for us as a city to invest and implement. And so in that case, instead of doing the investment, we get the dollars, we get the same amount of value, but it's a project that the city wouldn't implement. And then some work we did mentioning back to that notion that there are some projects, given the context, it doesn't make sense to do the more technical traffic impact study work. So we added a little bit of clarity about how we would determine that and making sure that it's sort of context specific. And we have a way to kind of calibrate the scale of that analysis. In some contexts, the area that we would look at would be smaller versus in some contexts a little bit larger. So just some clarity about how we would do the traffic impact studies. That's sort of it. I just give you a little bit of summary of the outcomes. Again, the notion that a reasonable amount, in this case, about 37% increase in the CTR, particularly the multimodal investment. We think that's important. A relatively, modest increase in the traffic impact studies, about 3% of the projects. I've already mentioned the notion that depending upon the scale, what a private project would have to invest in is somewhere between 30,000 and 140,000, again, based on the scale of the projects. And then just as a reminder, the community outcomes for us is this new process applies to all by right and rezoning petitions. And so that's different than what we do today. Most of that analysis we do is really around the conditional rezoning process. And it was really important for us, given what the scale and magnitude of the UDO and the notion that those new zoning districts will ultimately get mapped and sort of applied by right. It's really important for us to have a process that we could capture through the by right development process. And so that's really important part for us. Again, increase private investment in our multimodal infrastructure and really just a more predictable process for everyone, both the community and the development interest to get the goals, achieve the goals that we want, do it in a very transparent and consistent way, and hopefully implement the goals that we have from a mobility standpoint. So that's it. I just wanted to, again, give you an update, some of the technical analysis, the revisions and updates to the draft. As mentioned before, we've got public comment on that tonight. And then we're, again, the adoption of all the things I described in this manual is really following the adoption process of the UDO itself. So we have this public comment tonight, and hopefully the adoption of this when the UDO is adopted later in August. So I'm glad at that point to take any questions or have any discussion.
Thank you so much for keeping us in the loop on this, Ed. There's a ton of light bulbs going off, I can tell you that. Let me set some baseline just for me, but also might be helpful for commissioners. One of the earlier slides that you showed, I believe it might have been slide 3 or 4, where you showed the 3 questions that the CTR answers. And then there was the right side said, what's new? That one. What's new since when? Since the last time you were before this body, or?
Good question. What this is intending to say is what's new based on what we do today in the traffic impact process.
Okay, baseline 1. 2, was the CTR or streets map, was that done in partnership with one of the consultants, either Camiris or MIG?
No, we did all of that work. We did internal to the department. We had some support around the kind of CTR component from Nelson Nygaard, who was actually one of the consultants for the comprehensive plan. So a little bit of support there, but most of that work was really done by staff.
Okay. And then finally, same question, but as it applies to the analysis that was done for SMP. Work with a consultant or just internal?
The analysis so that was all, again, staff internal. We did all that work. Sort of needed to be staff, as I showed. I mean, we had to, really pull out a lot of detailed information in our own system around rezonings and by right permits. So yeah, we did all of that internal.
The slide that shows CTR multimodal assessment or traffic impact study.
Help me, which one you're?
Maybe that one. It could be that one.
Yep.
So in terms of its applicability going forward, these are not really seeing eyeglasses. And maybe this is a conversation that we can have offline, but I'm wondering how prudent it would be to have a multimodal assessment applied across the board. Your presentation sounds like it would only be applicable in certain circumstances, maybe certain zoning districts, et cetera. And I'm wondering if it would be beneficial to apply it just across the board.
Yeah, I know there's a lot on this slide, but let me use this to maybe try to answer your question. The multimodal assessment does apply across the board. So if you're a project of the scale that these guidelines set up, you're going to have to do a multimodal assessment. We've calibrated that back to this notion of sort of lower intensity places and higher intensity places. If you're in a low intensity place and you're one of those zoning districts, you're going to have to you're going to be eligible and potentially required to do the CTR based on the scale of your project. And so, in this case, we use the number of trips versus or the number of trips tied to a project to help calibrate that scale. But that would tell you in this case, whether you're a tier 1 or tier 2 or tier 3, you're going to do that multimodal assessment. And so again, if you're a certain scale, in a low intensity place, you're going to have to do the assessment. The scale of the investment you're going to have to make is going to be calibrated to those tiers. But again, across the board, you're going to be doing these analysis when it's triggered, when a project is a certain scale. There's certainly going to be projects that are below those scales who will just do their development by right. But we've kind of calibrated, once you get to a certain level, it's our anticipation and expectation that you're going to do the multimodal assessment. And then if you're a big enough project, you're also potentially going to have to do the traffic impact study as well.
Okay. Definitely need to follow up because I think I'm hearing some future bonus criteria in here somewhere. I know Commissioner Blumenthal, so everyone here at around this dais, and I'll check also our partners online. I'm going to start with Commissioner Blumenthal, please.
Thank you. And thank you again for the presentation. To piggyback on Chairwoman's question, is that kind of an either or with the TIS threshold and the development scale of whether it triggers the CRT, the CTR, excuse me?
See if I answer your question the right way. The triggers are going to, they're back to those sort of three categories: the multimodal assessment, the traffic impact study, and then again, some cases, the TDM. And so they all have slightly different triggers. And so like what's shown on this slide are in that first column is the triggers for traffic impact studies. I don't have on this slide, but there's separate different triggers for whether you're tier 1, tier 2, or tier 3. And so there's a pretty complex chart in the manual that helps you helps you calibrate where you fall. And that answered your question.
No, it does. I think I'm trying to digest all of this without having that chart. But, for example, on the development scale, under 150 units, you're below the threshold for that trigger, correct? In a neighborhood 1 zoning, for example.
Yeah, and that's correct. And that's, again, those numbers are specific to that TIS threshold. Those are just to give you a sense of what, say, 1,500 trips means from a single family project, from a townhome project or apartments. Those are just sort of comparables. Again, this slide probably doesn't show all of what you're asking. Those numbers, the development scale numbers, are really tied to that TIS threshold. There's separate thresholds for the multimodal analysis that are lower for sure. That goes back to that point of the numbers I shared. There's going to be lots of projects. I'll go to that slide. I mean, there's going to be a lot of projects.
And Ed, while you're doing that, it was just brought to our attention that I'm so sorry, those of us who are joining virtually were not able to have the benefit of seeing this presentation on the Zoom. I don't know if that's, we'll definitely make sure our commissioners get this emailed to them, but they don't have the benefit of actually seeing your presentation. You just see a picture of the conference room. My apologies, please. That just came to our attention, but please continue.
Yeah, just the point I was going to make, there are a lot of projects. These numbers kind of give you a sense of that, where you're going to be required to do the multimodal assessment, but not the TIS. And so, the triggers and the thresholds are lower, particularly for the multimodal assessment, because, back to this notion, we feel that that's pretty important. And we've calibrated a scale that we feel is a fair share impact for a project.
No, that makes sense. I think, where I was going with that was just encouragement to, obviously we have high intensity areas where this is a high priority, right? But not to leave out the lower intensity areas as well, because that's going to be, in my opinion, just as important. My other question relates to the rezoning process. Ideally, as we, pass the UDO and move forward, we're going to have fewer and fewer conditional rezonings and more conventional. A lot of times it won't be tied to a site plan. So are you anticipating, being able to capture some of these projects as then they go through the by right permitting process? If you're not able to get to it during the rezoning, is that kind of the thought process there?
Absolutely. Yeah, correct. Absolutely. And that is different than what we do today. So to your question, a by right rezoning, whether it goes through the rezoning process or in this case through the UDO, the kind of the sort of alignment rezonings that will happen with UDO. once you're a by right project, there's a lot of by right projects that never go through the rezoning process. And so these guidelines will apply to all of that, to both, the current by right rezonings based on the scale. And if they go through a rezoning process and it's just a by right development, we're not going to calibrate that at the rezoning process, to your point, because we don't have a site plan, we don't know the specifics of the project. But once it's ready and starts to go through the development review process for actual building and construction, these guidelines will apply, and to get their permit, they're going to have to meet these expectations.
Perfect. And then last thing, would you mind sharing? I know you said there was kind of a more complicated, let's call it a table behind the scenes that factors into a lot of this. Is that something you could share with us as well?
Absolutely. Yeah, absolutely. We'll make sure that everyone on the commission can get it. We've got drafts, or, essentially the final draft of the manual itself. It has that chart and all the details in it.
Awesome. That'd be fantastic. Thank you.
Commissioner Gusman.
Sure, a little bit of a lane shift. Thank you so much for that great question and good answer. That it's all out there. Good direction, definitely. I did have a specific question that arose more on the street maps portion after some community conversations that I had that dive into when we had a conflict between, I know we had the community input process. We certainly are getting really experienced at doing that. And I feel it works well generally. I also know after we collect that data, it's sometimes hard to decide how do we apply what the community feedback is, and what was your process for resolving conflict between a city organization, maybe fire, and community feedback saying something different for a specific street mapping? I don't want to get into specifics of any particular street, but I'm curious more about how did we resolve those conflicts in this process?
Sure. We modeled a little bit based on how specifically the policy map process went. So again, the streets map, actually the first draft of that came out in the fall. At the same time, the first draft of the policy map, we used a similar tool. So we had an online map, just like the policy map did. The community had an opportunity to click on any individual segment, put in their comment. And then what we did through that process, we spent, whatever it was, 6-9 months, following almost the same schedule as the policy map, took all those comments, did what you're describing. We looked at everyone individually, did our own internal assessment of, whether it conflicted with or whether we believed it was, something that we would change or something that we wouldn't. Again, we documented all that. There's a very specific kind of spreadsheet, analysis that is publicly available, where we went at every comment by comment, and if we changed it, we described why we changed it. We didn't change it. We described the rationale behind all that. So yes, there were certainly there were comments that didn't necessarily get reflected in the next draft, but we had a certain rationale around them. Most of them, were specific things, and I think there were a number of kind of refinements we did based on the eyes of the community. And what I showed that map. I mean, it was pretty comprehensive to look at every corridor, every street, and so we certainly knew that there was going to be some things we didn't catch, and certainly some comments from the public. So there was a fair amount of us, the community catching some good things that are reflected in the final draft.
Good deal. I just wanted to make sure that so it's very similar to the UDO process. All these comments are still out there. We can review how, if anything, anybody has particular questions.
Absolutely.
Perfect. Thank you.
Commissioner Barbie.
Thank you so much. Commissioner Blumenthal asked my zoning questions, so I'm appreciative of that. Thank you. My second question is specifically around how the public can begin to digest this, right? This is a lot of information, very in the weeds, lots of acronyms. Typically, especially on zoning, we will get emails from community members who are concerned, and they will often cite that there wasn't a traffic study done, or maybe they don't understand the traffic study. How will you all seek to push this out in a really comprehensive and easy way that even we as commissioners can say, here's a one pager about what triggers a traffic study. I really think that's important because we spend a lot of time spinning our wheels trying to explain this part.
Yeah, that's a great question and a good comment. And what I would say is we recognize that one of the things that we will be doing, sort of concurrent, I presume, to work that will be happening in the UDO process with the time between the adoption of this and the actual the actual time where it's going to be effective. And so one of the things we do know we need to do is really address the comment you're bringing up, which is making sure that we've got a process to be transparent with the community and the council. So for example, if it's going through a rezoning, it will be relatively easy for us. We need to design this process, but it'll be relatively easy for us to do a one pager that says, okay, this project is X square feet or whatever. Here's exactly how our tiers apply. We can kind of simplify the question about what that chart means. We can sort of just translate what that chart means to this specific project. And I think in a very relatively simple way, we can make that analysis, and that could be incorporated into the rezoning analysis that the planning staff does, and can be incorporated into the information that the planning committee and the council have as they're reviewing rezonings.
Yeah, I think that would be greatly appreciated. I would love to welcome you all to run that by the Planning Commission. Let us lay eyes on it, just as an outside looking in, to be able to say, yeah, this makes sense, or maybe it could be fill in the blank. So thank you so much for your consideration.
For sure. No, I'm glad you brought it up. It's something that we've sort of just been thinking about, but not fully. And so, yeah, we'll work with Allison and her team, and we'll be glad to come back once we've got some more thought on that.
We appreciate it. Thank you.
Commissioner Walton.
And can you flip back to the slide with the what's new thingamabobs? That's all one word, by the way.
Thingamabobs.
Thingamabobs. There it is. I had a question, and time frame, and can I comment on on-site bike shower facilities? And I'm assuming that is one of a number of different bike facilities. And I took a look at this last night, not in a lot of detail, but I just wanted to know, where do I need to look to find all of the different things that you guys are offering? Because bike security was one of the ones that's come up that I was aware of. And also the transit passes. And can I still get my comments in? Because you're having public hearing tonight. I didn't see a specific link for, hey, here's some more comments. And so I'm assuming that comment period is over. But I'm me, so I should be able to do this now. But I want to take a look at that real quick and just see if I have any additional things that we can talk about offline.
Sure. I mean, just to quickly focus you to where that is in our guidelines, and we can certainly send you, more specifically, so you don't have to kind of find it yourself. But a couple things. Again, back to the tying to the UDO. So there's, I'm not familiar with all the details, but the UDO has a set of new requirements around bike parking, et cetera. Yeah. So everything we've got in here really builds upon that. And so in this case, it really falls in the TDM. So if your project in the right, high intensity place, you will have set of triggers, and those triggers have the same kind of tiers, and you will be tied to a TDM expectation. Those tiers then are tied to a full menu of things you can do, like you've mentioned, bike facilities, transit passes. There's a pretty big menu. And so developers can then pick and choose to get the number of points they need. So it doesn't necessarily mean that they're always going to choose the bike things on the option. They might choose a different set of menu. But we do have a menu. It includes, example, it includes providing an on-site end of trip kind of facility, showers and things. And so again, it's embedded in that. I'll share with you, make sure you can see the menu of the things that are tied to that essentially the new bike stuff on top of what the UDO does is embedded in the menu of expectations we have around TDM.
Okay.
One other little point about that, and this is something we did with Allison and their team as they were finalizing the second draft of the UDO is if a project, in this case through the CTR, actually achieves more points than it's required, let's use the TDM as an example, there is a way to get a bonus in the UDO. So there's some incentive and encouragement to do things even above these guidelines, and it's tied to the UDO's ability to provide, development intensity bonus. So it's an important connection. So there's certainly projects that will do things, potentially have the ability to do things above these guidelines, and the UDO and the development process is designed in a way to incentivize that kind of investment.
So if I come up with some innovative thingamabob, then I can get brownie points for that, because even though staff may not have ever thought of it before, is what is.
Well, yeah, two things. I mean, if you actually provide more points than what's required, like you picked a set of, and you were already doing sort of a set of things from our menu that goes above and beyond the point expectation, those above things give you the bonus. To your point about things that aren't in our menu, we also recognize, and part of our process will be to regularly kind of update that menu based on things that we learn and new ideas that will come about. I mean, particularly around TDM, it's something that we haven't done formally yet, so we know we have lots to learn. There's been some pretty significant rezonings, large-scale rezonings, where we've negotiated some things through the conditional rezoning process around TDM, but it was negotiated. And so these guidelines are new and sort of intended to make that process a little bit clearer, but we also know we've got lots to learn, and there'll be lots of opportunities to kind of update those guidelines in the menu, particularly around TDM.
Okay. I can imagine there's probably some unintended consequences of something that somebody does, and then all of a sudden you see it's a wonderful thing or something like that.
No, absolutely correct.
Okay. All right. Thanks.
Blumenthal.
Just two more quick things based upon some of my fellow commissioners' comments. One would be, kind of an appreciation for updating that menu, right? For example, you don't need bike shower facilities on 3 parcels in a row, right? Just because somebody wants to check that box. The second one, to follow Commissioner Barbie's, is as you look through, you're talking about kind of building out a framework as an examination for rezoning petitions. One thing that and I think I speak for several of us, have found incredibly helpful, even as I'm rotating onto the planning committee side, has been, for just as an example, the analysis of the 2040 comprehensive plan and the 10 goals, and how it's just as simple as a check, an X, or an NA, right? Like, do you meet this criteria? Do you not, or is it not applicable? And if you want to flesh that out, great, but I don't even know that you need to. But just something like that has been very helpful. It takes us 30 seconds to look at it and break it down, but really gives us a lot of context that we wouldn't have otherwise. So, as you look at that, and, Commissioner Barbie and I are also on a subcommittee looking at environmental sustainability for the Planning Commission as a whole, revising a statement, but then talking about how that can be further applied in the work that we do. And one thing that we've kind of very preliminarily started talking with Dave Pettin about is how we can even incorporate the sustainability component into some sort of a checklist like that, just because it makes it so much more straightforward to look at, digest, and move on. Obviously, we want to be conscientious of asking other people to do work while, we're just sitting here talking to you. But at the same time, I do think that improves the kind of efficacy of the whole process.
No, that's great feedback. And absolutely. And you're right. I mean, our job is to make it as easy for decision makers to assess. And so for sure, that I appreciate that feedback. And as I mentioned, we'll be thinking about and testing it. And we'll be glad to certainly come back to this group to get some more feedback on that.
I think a lot of this, Ed, is very reminiscent of the work we did on the Charlotte Moves Task Force. And I'm not sure if the S&P was kind of born of that, but it was kind of the first iteration, right? One of those things was the fee in lieu of, which I was hunting for an email that I sent August of 2020 to that exact regard. So I'm excited to see it in here. And I'm wondering though, how much control does a developer have in directing those fees or those funds specifically?
I won't say none, but I'll say really, it's really tied to, again, the example would be the point system says, you know, or through the process, through the points, we identify that, for example, they're going to do a pedestrian crossing a block away, right? And what the fee in lieu is designed to be kind of a backstop to, if implementing that from a private developer standpoint is takes too much time or gets to a, you know, an issue around needing an easement or some additional right of way, it allows us to have identified that project, make sure we don't lose the private investment we were going to get, but they give us those dollars and we do the implementation. So in theory, it's supposed to be very specific to projects that get identified in the process, but really be a way to address, you know, complications or obstacles for the private development community to invest. What can definitely happen on corridors or other places where there's lots of fast growth happening. I mean, that fee in lieu, those dollars can be, and it gives us the discretion to take those, to take that investment and, you know, accumulate it across the corridor and sort of define what is, you know, a more corridor kind of holistic set of pedestrian investments and use those dollars to either invest or augment already public investment to do those projects, you know, kind of more holistically around a corridor. So a little bit of both, but I think our main intent is to try to use that only when we need to, mostly, and tie it to projects that already get identified from those specific development projects, so that we're not we're not leaving it too open for debate. And there has to be a rational nexus between the impact of that project and the investment. So we can't be too liberal about applying that, because otherwise we lose our justification around, you know, essentially the impact of the project.
Yeah, and I think your comments around looking at it from a more holistic, maybe corridor specific transportation infrastructure fund that may be corridor specific is kind of where I was leading to. I don't even know if that's a thing, but I think that, again, something that came out of this Charlotte Moves Task Force is an idea worth exploring a little bit further if it hasn't already been done as part of the S&P. Thank you.
Yeah, great.
Anything else for Ed? Thank you. Thank you. A lot of technical stuff, but it's good. All good. Thank you so much.
Yeah, thank you. I appreciate all the feedback, and we'll be back for sure on some of these issues we talked about.
Okay, we'll see you tonight. Okay, so to wrap up, almost perfect timing, to wrap up our meeting today, to finish our agenda here, future work session agenda topics. It's not much there, being as though August is a vacation month for most of the commission. Sorry, zoning committee. You guys do have 2 meetings in August. Sorry, state legislature doesn't allow breaks for the zoning committee. So sorry. But other than that, there's not a whole lot happening meeting wise for the planning commission, but obviously we want to stay in tune to the August 22nd council vote on the UDO. Also on your, or put on your radar, I think September 9th is a tentative date that we're looking at for the annual retreat, which we do plan to host in person. So kind of pencil that into you guys' calendar. Thank you for popping that up, Candace. Yep. That's exactly what I got. So there's not a whole lot meeting wise that's happening in August, except for zoning committee, other than the council 822 vote on the UDO. Tonight, I look forward to seeing those of you who have RSVP'd. I think there's 8 of us total that will be in attendance tonight. So thank you for the flexibility. And then Monday, I'm sorry, not Monday. Tuesday, the 19th, I got to get Mondays now out of my brain. Tuesday, the 19th, I invite all planning commission members to join us as the planning committee makes its recommendation on the UDO to council.
Madam Chair, is that meeting going to be in person or are we still virtualing?
I would love to see my committee in person, but at this juncture, there is a hybrid, that meeting is hybrid.
Okay. I'll talk to you in a minute.
Okay. I would love to see the planning committee there at minimum, but planning commission members are also welcome to attend in person. And then last thing, I believe, for the good of the order, thank you so very much to Commissioner Blumenthal, who made space out of his birthday today to attend our meeting. So thank you and happy birthday, Commissioner Blumenthal. So for those of you who are joining us tonight, I will be sending a quick either text or email. I'm not sure if I have everybody's mobile number, but definitely an email regarding maybe a little bit of a tighter window in terms of our arrival time for tonight. Council meeting does start at 5, but I think the public hearing on the UDO isn't until probably at best a 6 o'clock hour. And I don't want to quote that for sure, though.
It'll be later than that because the public forum is first and that's at 6:30.
Okay.
Yeah.
So we're getting a little deep into the agenda.
I thought we were first on the agenda at one
We are, but
point.
they have the action review first. And so they listen to
Okay.
those items and then they move into the chamber. And so at 6:30, the meeting starts and they'll have the public forum. And then the next is UDO.
Okay.
Sorry. At least we're first on the business meeting.
Yes.
I'm excited about that inside.
Does that give us a ballpark time, Allison, of
I mean,
anything?
I'd say 6:45. I mean, I need to look at the agenda. There's usually like some proclamations
Sure.
and, those sorts
Yeah.
of things, but it's the first real
Those
agenda
always,
item.
they don't seem to take that long when you're just watching at home and walking in and out of the room.
Yeah. Okay.
I think 6:30 is a good window for arrival
Yeah.
times and
Okay.
Are we seated in the chamber or in the back area where like zoning uses it?
no, I think it's actually in a chamber crowd, but we're in the first row.
Okay, I was hoping for some VIP treatment.
Just, there's a little bullpen, so,
Okay.
if you roll down the stairs, you can get there.
Okay, anybody
rolling
else
you back
have anything else for the good of the order today?
Motion to close.
And the birthday man has made a motion to close. Do we have a second?
Sure.
Okay, we'll consider that unanimous consent, seeing as though it came from the birthday boy. Everybody enjoy the rest of your Monday. See you this evening. Thank you.
That's what I was saying. Yeah.
Well, I watched just to see what kind of hell it was gonna be. And the first hour was hilarious because it was the. Okay, that's fine. And then I put you on one half speed. There's some other you're on 2 speed. It's really hard to know where, and it's like you miss a.
Yeah.
So I'm saying,